All right, hey everyone, and welcome to today's office hours. In just a moment, I'm going to get the slides to where we need them to be. Perfect. Okay, so this is Natalie Matthews from Apt Associates, and we're excited to have you all here today for these office hours. I just have a brief logistical slide that I'd like to go over before I turn things over to our team of experts. So everyone who is an attendee today will be in listen-only mode, meaning we cannot verbally hear you unless you are a panelist. But we do still absolutely want to engage with you throughout our time together. So everyone should see on their screen what looks like a little chat bubble. If you go ahead and if you click on that button, it will open up the chat feature for you. And the chat feature is what allows you to send comments, questions, feedback into the presenters during our time together. When you are sending a message, please make sure that you send it to all participants. It should default to all participants for you, but if it does not, please make sure that you select that from the drop-down menu. If you are trying to join us by phone, then please use the call-in information that appears on the screen, and we will, of course, send that to you in the chat box as well if you need a reminder of it or need to find it later on. This webinar is being recorded, and both a recording of the webinar as well as the slides will all be posted to the HUD Exchange within 2 to 3 business days, so please be on the lookout for that. And with that, I am going to turn things all over to our first speaker of the day to do a formal welcome and introduction.
Good morning. Thank you, Natalie. I'm Jill Casey. I am a CPD field rep from the Buffalo office. Go Buffalo. And I am very grateful to have a full cadre of HUD experts today to address all of your questions that you have around submitting your amendment. So first we want to welcome you and thank you for joining us today, making time in what we know are very busy schedules, and also for all the work you've been doing during this unprecedented time of COVID, keeping your communities going and your families safe. So thank you all. We also thank you for the patience that you have had with HUD as we work at fast speed here to get you both information and resources as quickly as we can. We know there's more questions than answers sometimes, so we're grateful for you all hanging in there with us. Today we're going to go through the amendment process that you can, the steps you can follow to submit your CARES Act amendments. And we are going to start off with a group of panelists led by Katie Burke. Katie is the director of the Denver Field Office CPD team and will be presenting the bulk of the information. We have a number of panelists to answer questions throughout that, both IDIS questions and some programmatic how to set up project questions in IDIS. That team's going to be led by Jesse Hanforth-Combe, the director of HUD's Office of Block Grant Assistance, and Marlisa Grogan and Brett Elsters from our Special Needs Assistance Program. So welcome everyone, and especially to the many experts behind the scenes helping field questions. So thank you. Next slide, please. Our agenda today is going to be to go through what your amendment options are, help you think about what is the most expedient, helpful one for you. We are going to go step by step deep into IDIS territory to show you how to set that up and answer your questions. Just as a point of clarification for our HOPWA grantees, we are only addressing HOPWA formula funds today. This will not be applicable to HOPWA competitive grants. Next slide, please. Excellent. So we're going to talk about your options, and with that, I would like to turn it over to my colleague, Katie Burke.
Hi, thanks so much, Jill. Welcome, everyone, and we are just going to dive right into the fun. The biggest question that is going to be on everyone's minds is, how do we submit for the CARES Act grant, and what should my community be doing? So there are 2 options for you to submit for your CARES Act funds. You can submit for them through a new 2020 plan submission, and that would be together with your other 2020 routine formula grants that have been awarded to you, or you will amend your most recently approved plan. For most of you, that is probably your 2019 plan, although there are a few of you early birds who have already gotten your 2020 plan approved. So you will want to amend the most recently approved plan, and you are going to stick with that amendment through all tranches, through all waves of funding that may come through. That one amendment is going to be your CARES Act amendment throughout this process. Next slide. So let's talk a little bit more about these different options. So if you are going to amend your plan, this is the one that HUD is really recommending if it's possible for you right now, because it is going to be an expedited review. We have just a few minimum items that we need to make sure are correct on the field office side, and we will then be able to really expeditiously get you your grant agreements and get those funds moving. Otherwise, if you submit through your 2020 consolidated plan, you are going to be subject to the 45-day HUD review timeline. And that's because your field office is going to have to review for all the other components that go into a consolidated plan. We'll be looking at your resale recapture, at your ESG and homeless consultation and participation. So be sure that you're really sure about what you're ready to submit for. And if you would like to get started spending your CARES funds right away, amending your plan is really the way to go. If you're going to have multiple award types that have been granted to you, such as CDBG-CV and ESG-CV, whether you're amending your plan or you're submitting together with your new plan, you do not have to submit for all of the funds at once. You can submit in stages as you're ready to apply for those different grant types. When it comes to the public comment period, I want to make sure that we're clear on the requirements for each of these types of submissions. So if you're amending your plan, you can utilize a 5-day public comment minimum period, and that's if you've submitted a waiver notification to your field office. Remember that your citizen participation plan must also be amended to reflect these changes that you've made and how you're going to conduct citizen participation during the time of COVID. You can concurrently amend your citizen participation plan together with your substantial amendment. So you can utilize that same shortened 5-day public comment period to amend your CPP as well as your substantial amendment. If you're going to amend, or if you're going to submit in your 2020 plan, you also may utilize the 5-day minimum public comment period that was established in the CARES Act. But again, please be sure to amend your citizen participation plan to reflect what your new procedures are going to be. And likewise, this can be done concurrently with your 5-day public comment period that you're using for your con plan or your action plan. Next slide.
Katie, on that point, if a community has to amend their citizen participation plan, and that requires going to their local city council or county legislature, and that process is going to take more than 5 days, what do we recommend? Following their local policy for that amendment, or?
Good question, Jill. So yes, you will still need to follow your own local policy and process. 5 days is the minimum period, but if your local process takes longer, then it takes longer. We just wanted to offer through this waiver that was granted through the CARES Act and through the memo, it's to allow you to use a minimum period if it works for your community. But otherwise, you do need to follow your local policies and procedures. Thanks, Jill.
Thank you.
So if there are any of you out there who are scratching your head thinking, you know, I don't know which plan I should use, I'm not sure if I should amend my 2019, am I ready to submit my 2020, please, please reach out to your local CPD field office and we will help you work through which plan you should choose and which the appropriate one is. We want to make it as easy for you as possible. And in particular, if you're one of those grantees who perhaps you've submitted your 2020 plan just a few days ago and it's still being reviewed by the field office, you might be wondering, can I still amend my 2019 plan? Should I wait for my 2020 plan to get approved and then do a substantial amendment for the CARES funds? Those are questions that you can work directly with your field office about, because they may have some good information for you about where your plan is at in terms of maybe it's about ready to be approved tomorrow, and you would then be able to do an amendment quickly. Maybe there are more significant issues with your con plan that are going to require rejection and resubmission, and you would be better off utilizing the 2019 amendment in the meantime. So it will be specific to you, and that's why we really recommend you reach out to your field office just to confirm what the most expeditious and easiest option is going to be for you. Next slide.
Katie, on that front, just about timing, HUD normally has 45 days to approve a con plan. Is that time frame going to be different for amendments?
Yes, so amendments are not under the 45-day review period. We are in the field office going to expedite those reviews as quickly as we can and turn them around as quickly as we can. We are really looking for what I call bare minimum requirements that need to be correct in your submission. If any changes are required, we will work on quickly turning that around with you. And we've built this process to really allow for quick back and forth, quick updates, quick review, and quick grant agreements, our favorite thing. So I'll be walking through those submission requirements next, and we'll talk about what that process is going to look like. Thanks so much. Next slide. Every submission for your CV grant funds is going to need to include the following items. You are going to need a separate SF424 specific to each CV grant program that you're applying to. You're going to need a separate SF424D for each CV grant program that you're applying for. You will need signed certifications for each CV grant program specifically, and a special reminder that ESG-CV has updated certifications. Those are posted on the HUD Exchange, and it's important to use those as it removes some of the requirements for ESG-CV in that cert that the CARES Act put into place for ESG. You will need to report on your citizen participation that you conducted for CDBG and HOPWA-CV, or if you're only going to apply for your ESG-CV, you'll need to address your public notification that you made. And just a reminder that per the CARES Act, ESG-CV only requires public notification and not a public comment period. So keep that in mind if you're ready to submit for ESG-CV now. Finally, you'll need to take a couple of actions in IDIS. You will need to update your AP15 expected resources screen to show your allocations for CARES funding that you're applying for. And finally, you'll need to update projects and add your CARES Act projects as applicable. So we're going to go through each of these in a little bit more detail coming up in the next slide. So grantees must apply for your CARES Act funding by amending your 2020 plan if your 2020 plan is already marked as review complete in IDIS, or if your plan has been submitted and maybe it still shows that it's under review or in submitted status, but 45 days have elapsed from the date when you submitted it and the plan has not been disapproved, meaning you haven't received a rejection notification letter from your field office. So if you are in the small segment of grantees who went ahead and submitted a 2020 plan and have gotten it approved, you will be amending your 2020 plan to submit for your CARES funds. Next slide. So just a reminder that grantees can submit your initial 2020 plan if you're opting to use that option, and you can include one, some, or all of your CV allocations. So you do not have to include all of your awarded CV grants if you're not ready to submit for them with your initial plan. You could, for example, only submit for ESG-CV and then later amend your plan to submit for CDBG-CV when you're ready. We want to make sure everyone is really clear that if you're going to submit for your CARES funds together with your initial 2020 formula plan submission, your plan is going to need to meet all the other regulatory requirements as well. And the field office is going to do its best to review it as quickly as possible, but it is a much larger plan with many more requirements. And just understand that the review period and issuance of grant agreements may be longer because of that. Next slide.
And Katie, on that front, the folks who are waiting with their 2020 plan also have a delayed option to submit their plan later. That would further delay getting the CARES Act funding if grantees choose to do that.
That's correct. Great point, Jill. So something else to take into consideration is really the timing of when you want to start to be able to use your CARES Act funds, and really thinking about that 2019 amendment option as being your best go-to. And I think it's also important for folks to remember, just because you're submitting this application for these new CV funds through a 2019 amendment, that has nothing to do with your regular program year. It does not mean that you're only limited to spending CARES Act funds within your 2019 program year. The CARES Act funds are a separate funding source. They have their own expenditure deadline and their own requirements. So they are not connected to your 2019 regular formula year. So rest assured, if you submit with your 2019 substantial amendment, you're not limiting yourself. You're in fact just choosing the easiest option if that one's still available to you. Thanks, Jill. So for those of you who are going to be submitting a substantial amendment, which we imagine will be most of you, we tried to make this as clear and as easy as possible. I know IDIS isn't always everyone's favorite system to use, and so we wanted to try to facilitate keeping this as clean as possible, and even especially keeping in mind those consortia out there who have multiple members trying to work together on the same plan. So what we are asking you all to do is to create one version of the substantial amendment in IDIS. No matter how many CARES Act funding types you have, no matter how many allocations or additional tranches come through, no matter how many members are in your consortium, create one amendment. We are going to call it the community name CARES Act Amendment, and that is going to be the document that we send back and forth to each other between the field and the grantee until all of our funds have been taken care of, until all projects have been added. And we'll just continue to use that same document and keep it really clear that this is separate from your regular formula programs. So as you submit this single substantial amendment, when you're ready, HUD will review again as expeditiously as possible and really just looking to make sure that the bare minimum requirements are present. As soon as we are able to verify for individual programs that it is substantially complete, your field office will immediately issue you a transmittal letter and a grant agreement indicating that the amendment for that grant source has been completed and you are now ready to move into the funding stage. Once we do that, the field office will then return that amendment back to you using the reviewed and awaiting modification status in IDIS. So this means that it's turned back to the grantee, open to you to make additions, changes, revisions, apply for more funding, allow other members in your consortium to apply for funding, and then once you're ready to submit again, you can hit submit and we'll just continue this process all the way through until all the CARES funds have been awarded. Next slide. So I hope I'm driving home. We are trying so hard to make this as easy as possible. Nothing is easy right now, whether you're like me and you have a 3-year-old at home with you asking for a new snack every 5 minutes, or whether you're being, locked into your apartment alone, trying to take caution in your office where you work, and dealing with the many client issues and city issues that I know everyone is facing right now. Let us make it easy for you. We have provided detailed instructions, screenshots, step-by-step to walk you through how to do this. Please make sure that you have the IDIS setting up a substantial amendment for CARES Act funding document downloaded and ready to go. While it also has instructions not just for setting up substantial amendments, but also for how to submit with an initial 2020 plan. So please let us help you and make it easy. Next slide. Okay, so if you are one of the states or communities who may get a subsequent CARES Act allocation after the first wave was announced, you may need to submit for additional funds. If you do so, you are going to have to update your SF-424 as appropriate for each of the CV programs. And that 424 is going to be cumulative of all of the CARES Act funding allocations under that program. And we'll give you an example and talk through what that means for a SF-424 to be cumulative. You're going to need to update your citizen participation. You're going to want to provide narrative of the 5-day minimum comment period that you may have completed, or if you're only submitting for ESG-CV additional allocations, again, that only requires public notification per the CARES Act. You're going to want to update your allocation screen in the AP15 to increase the funding amount, again, cumulatively for the amount of funds that you were awarded through that program. And finally, you're going to update your projects, add funding, add new projects if applicable. But these are really the 4 minimal steps that you'll need to take once you have a substantial amendment or a plan set up to apply for your CARES funds. So we'll trying to keep it minimal and easy for you to continue to apply for your additional awards. Next slide.
Katie, we've had a few questions around those basic submission questions of what would have to be done. The first is around 424s. Does everyone have to submit a 424D regardless of construction activities planned or not?
Yes, that's correct. Every community will need to submit an SF424D for each grant type that they've been awarded. Same for with your formula grants.
And a couple questions on the documentation required for citizen participation as well. We have been saying you have to evidence that you followed your citizen participation plan and provided an opportunity to comment. Is HUD have we issued any specific language or requirements around that? And can we quickly address the public hearing question of alternatives, virtual alternatives?
Sure. So I want to invite any of my panelists who are on the call. If you would like to jump in to address either part of that, you are welcome. Regarding the virtual hearings, these should be made available and accessible as much as possible and practical to your citizens. You do need to provide reasonable notification. And then you do need to have an ability to collect questions and respond to them in a timely manner, although it does not necessarily have to be live responses. You'll then want to collect those questions and responses. Be sure that you document when you held your public comment period and provide that information specifically in your submission for the CARES Act funds. You do not need to attach your amended citizen participation plan, although remember you are required to amend that citizen participation plan, maintain that documentation of that process locally and that documentation. And otherwise, we are really just looking for the forward verification submitted in IDIS that you met those basic requirements. I don't know if my colleagues have any other any comments that they want to jump in with. Otherwise, I will move on.
Just a point of clarification on the hearing question. HUD has allowed for a waiver on the shortened time and allowed for virtual meetings. So for folks that are still under stay-at-home orders and your state or community can't have meetings of more than 10 people, the virtual meetings are acceptable, and just include that in your record keeping so you can demonstrate compliance. So with that, Katie, we have an amendment question slide here about submitting an amendment one program at a time.
Yes, so we want to make sure that we really drive home to everyone. You may submit a substantial amendment for all, some, or even one grant at a time, and HUD, your local field office, will award individual grant agreements as each submission meets the base requirements for that grant. We'll then quickly return that plan to you so that you can then edit it to add additional funding as it might be awarded to you. So even if you submit for CDBG-CV and ESG-CV in your first substantial amendment submission to your field office, they might look at it and say, well, you know, your SF424 is correct for the CDBG-CV, but you forgot to sign it for ESG-CV. In that case, the field office, if the CDBG-CV requirements were otherwise met, they would be able to issue that grant agreement for CDBG-CV for you right away. And then we would return the plan for you quickly, so then you could update your ESG CV documentation. Make sure you get the signed copy in there. And once you send it back to us, we would then be able to issue the ESG-CV grant agreement. So again, this is meant to be as friendly as possible to give you grace for making mistakes and really minimize the amount of time that elapses between being able to resubmit and make quick corrections to your plan.
It also allows for member consortiums to be able to toggle back and forth. So if one member's ready to go, they can get theirs in while the next member's preparing and not have to queue up waiting, especially for consortiums with a lot of members submitting amendments. So keep that in mind.
That's exactly right. Shout out to Salt Lake County, Utah, who I hope are listening to this and feeling good about the chance for being able to submit as they're individually ready to go instead of waiting for all members. I think they have 8 members in that consortium. We're thinking about you guys when we make these processes. All right, next slide. And we've got another FAQ here. So you might be asking yourself, like, wait, can we even receive funding if our amendment isn't in review completed status? And can we fund projects and activities if the amendment isn't in review completed status? And we want to assure you that, yes, you certainly will be able to receive your funding through the grant agreement that will be issued as soon as we determine that your submission is complete. You will know that it's been approved by seeing that grant agreement hit your email inbox. And as soon as the grant agreement has been fully executed and uploaded into IDIS with the funds released, you will be able to fund activities as you wish. And it does not matter what status your amendment or plan is in. Next slide. Okay.
Let's get into the IDIS weeds here and go through the specific instructions that everyone will need to complete this.
Fantastic. We know this was the exciting content that you all were waiting for at home, but let's make sure we'll cover the basics of each program and of each screen that you'll need to complete in order to submit for your CARES Act funds. I'll lightly touch on the individual programs, and then I really hope that you all take advantage of the Q&A time to ask specific questions about setting up projects and funding projects for the individual CV grants. So let's get into it. Again, we really wanted to minimize the number of steps that you as a grantee will need to take to submit for your CARES Act funds and IDIS. So first up, you're going to want to upload your SF-424s and 424Ds, your certifications, and then any citizen participation or public notification documents in the AD 25 or 26 screen. Step 2, you're going to add the CARES Act funding in the AP 15 resources screen. In step 3, you're going to include your CARES Act proposed projects in the AP 35 screen. If you're a state, then in step 4, you will update the other screens in your AP 30 for the method of distribution. And if you're one of the grantees to receive HOPWA-CV, you'll need to do some updates in the AP 90. So we'll walk through each of these in a little more detail coming up on the next slide. All right, so let's talk to SF-424 and 424D. So one SF-424 should be completed for each separate CV grant. When you're filling those out, there are a few items we want to make sure that you're paying attention to. Make sure that your DUNS number is correct and ensure that your award amount is correct. And again, these are going to need to be cumulative totals for additional rounds of funding if you're going to receive funding. You're going to want to enter your CV grant amount on the federal funding line. You're going to want to enter the CSDA number for the formula program that you're using. At this time, that is the approach that we're going to use. Stay tuned. If there is going to be a separate CSDA number, we will let you know and issue corrections. For now, please use the formula CSDA program number. So for CDBG-CV, you would use the CDBG-CSDA number. How's that for alphabet soup? You're also going to want to make sure that the 424 and 424D are electronically signed and dated by the elected official or his or her designee. And be sure that you maintain at least one original wet signature copy locally. You're also going to want to complete an SF424D for each program, and same thing, make sure that it's labeled for the individual program that you're submitting for, and make sure that it's signed and dated with a wet copy on file. So on the AD26 screen, when you create the amendment, you're going to want to, one, make sure that it's the right program year, so 2019 or 2020 if you're one of those early birds. In the AAP title screen, you're going to want to make sure that you indicate, in this case, this example, community is state of Rhode Island. So it's the PY 2019 Rhode Island CARES Act Amendment. And this is just to be extra clear between the field office, all of your staff, consortium members, if you're a consortia, that this is your CARES Act amendment. It just really helps call it out, and I think it'll help for reporting and compliance on the back end. Your action plan version will be automatically created. Be sure that you indicate that the amendment is substantial. And in the purpose of the amendment, you will need to add text indicating that this is the CARES Act fund amendment. If you have multiple sources of funding that you're applying for, be sure that you call out the individual grants that you're applying for with this submission. And if you're a consortium, please do use this box to indicate which communities are submitting an application in this particular amendment. Next slide. So let's quickly talk about this cryptic cumulative funding that I've referenced a couple of times. So on the SF424, you'll see in box 18, you are estimating your funding. So let's imagine that you are the city of Pawnee, Indiana, and you receive $1 million in your first ESG-CV allocation. Your first SF424 will report $1 million under box A, federal, in the 18 estimated funding box, and it'll total to $1 million. Next slide. So then Pawnee was lucky enough to receive a second allocation of ESG-CV for $500,000. The cumulative SF424 that they'll need to resubmit will now state $1.5 million in the federal estimated funding box. Even though they're applying for their additional $500,000, they're going to need to show the cumulative total of ESG-CV funds that they've been awarded. Next slide. So a really special note here. It is very important that you do not overwrite your existing SF424s and certifications that you initially submitted with your 2019 plan. We still need to have those on record in IDIS. So to avoid overwriting those existing forms, here are the steps that you can take. You're going to want to click the View button that's next to that attachment in IDIS on that AD26 screen. Once you view it, you're going to be able to download it and then save it. So that's the most important part, just to make sure that you have a saved local copy of those 424s and certs. Then you'll want to, after you're sure that you have a saved copy, go ahead and delete the attachment that was there. You'll want to combine your new 424s together with your older 424s and then submit them together as one PDF in IDIS. If you have any issues with that, or if you don't have the software to be able to combine PDFs, please reach out to your field office. That's something that we can assist you with. Next slide. So just a special note, you will also need to upload your certifications, and we do have the certifications posted on the HUD Exchange. You'll want to make sure that you use the relevant certifications for the programs that you're applying for, including the state-specific certifications if you're a state, as well as the ESG-CV certifications that are currently sitting on HUD Exchange and that you'll want to be sure to use for your ESG-CV submission. Next slide. So also in the AD26, you're going to want to upload a summary of citizen participation efforts, including a summary of comments received and how they were responded to, or a description of your ESG-CV public notification that you conducted, if that's applicable to you. So you may want to update your citizen participation chart in the AP12 If you would like to elaborate more on the citizen participation efforts that you've undertaken, by all means, we support that and would be happy to look at that and assist you with. However, it is not required for you to update your AP12. It is solely if you want to add that piece of record keeping to IDIS. Next slide. All right, so now we're on to the AP15, and this is where you're going to enter your CARES Act funds into the expected resource table. So if you are submitting for this and in your con plan, in your initial con plan for 2020, you're going to want to use the SP35. If you are in an action plan year that's in between years 2 and 5, you'll be adding to the AP15 screen. So you're going to add the CARES Act allocations as an other funding source on the SP35 or the AP15. And then in that other field, you're going to reflect the allocations for each of the CARES Act grants that you're applying for by that grant's name. So it would state, for example, other-CDBG-CV or other-ESG-CV. Next slide.
Yeah, Katie, we've gotten a number of questions there about tracking grant program years, grant year programs. So just as a point of clarification for everyone, your 2020 normal CDBG, ESG, HOPWA grants will be tracked separately from your CV grant. They are a separate grant, and they will be reported on separately, entered into the funding separately. So you'll have a different agreement for each of those sources.
That's correct, and exactly. On the AP15, you will still have your formula funds in that CDB source of funds, CDBG source of funds home. And you'll still be funding activities, reporting on those activities for your regular program year. For these CV funds, we are creating a special, there's a unique grant number that will be for the CV funds. This is a new application. You'll be funding them separately in the AP15. You'll have a separate account in IDIS to fund those CV activities. So yes, be sure that you kind of mentally disconnect your CARES Act activities and grants from the normal program year structure. I know it's a little hard to do because we live and breathe in our program year in IDIS, but in this case, we are cutting you loose. You will be reporting separately, tracking separately, but still using IDIS and the familiar model to do so. So this is just a friend. Sure.
Sorry, this is Katie from HOPWA. I just saw a question about for formula grantees if they should be including their competitive award here too in the AP15. So they do not need to include the competitive award in this section in IDIS. Thanks.
Yes, thank you, Katie. Again, I think Jill mentioned at the beginning, but let's drive it home again. If you are receiving HOPWA-CV competitive grant funds, you will apply for those through a separate process, and it will not be included in IDIS. So when we're referencing HOPWA-CV during this presentation, we only mean those HOPWA-CV formula grants that were awarded. Thanks for that clarification, Katie. So this is just a slide to show you how you add additional other funds in the AP15. And again, please use the handy dandy screenshot IDIS guide that we've put together for you. It will really walk you through exactly where you need to click, what you need to add. It even tells you what to type in some of the narrative fields. So please be sure to reference that. Next slide. So once you click the add in the AP15, it will take you to this screen. For your anticipated resource, when you select other, this is what will pop up. You'll have the chance to type in under other funding source, the grant type that you're applying for. So this is where you would put in as applicable CDBG-CV or ESG-CV or HOPWA-CV. On the next field, you're going to fill in the expected amount that was available, which is the amount that was awarded to you and that you're applying for. Please be sure that you leave the next field blank. That's the field that says amount expected for the remainder of the consolidated plan. That should be left blank. That's because these are a totally separate formula award, and they're not part of your regular formula grants that are covered by the con plan. You'll want to give a narrative description to this other field. And again, we have given you some stock language. Please feel free to go ahead and use it. Try to make it a little easier. And finally, you're going to want to select under uses of funds. You may have other items to select in there based on what it is that you're doing, but at a minimum, you're going to need to select other and then indicate prevent, prepare for, and respond to coronavirus. Again, just go ahead and use the language that we've provided for you. And this will make it clear that these funds are specific to COVID-19 response and the CARES Act. So after you do that, you'll be able to hit save and return, and you'll be ready to move on to the next program or the next screens. Next slide. All right, so the AP 15 is done, and we're on to the final piece of setting up your CARES Act plan. In the AP 35, you are going to need to enter your proposed CARES Act projects. So similar to how you already use IDIS, you're going to create your CARES Act projects in the AP 35. For states who are listening, your AP 35 is going to contain limited information. However, your AP 30 method of distribution screen needs to be updated to show how your method of distribution is being modified to distribute CARES funds. The project setup requirements are different for each of the three programs for CDBG, ESG, and HOPWA-CV. And the guide that we made really goes into specifics on what exactly you'll need to do for each of these items. I'm going to do a brief overview in the next couple of slides so as not to totally bore you to death. But if you do have more specific questions as I'm going through these final slides, feel free to throw them in the chat box and we'll try to address them with our program experts. Next slide. All right, so let's talk CDBG-CV first. So for you guys, for you CDBG folks, this is going to be following the normal process. Under the Plans Projects Activity tab, you're going to click Add under the Project submenu. When it asks for the program year, you're going to select 2020. Some of you might be asking, well, what if I'm amending my 2019 plan? You are still going to select 2020 as your project year. You're going to want to adopt a naming protocol that makes it clear that this project is a CARES Act or CV project. We recommend keeping it easy and naming your project CV-Public Services, CV-Infrastructure, just to make it really clear as you're trying to do your own reporting and tracking what exactly your CARES Act projects are. And then finally, you'll want to type in a project description that is clear enough to know how your project is addressing or responding to COVID-19 in your community. All right, let's talk ESG-CV. So for adding your ESG-CV projects, if you're going to amend your 2019 plan, you're going to need to do something a little out of order. So you're going to need to first create a 2020 project in the IDIS project module and selecting the 2020 program year for that project. Then you're doing that outside of your substantial amendment setup. Just in regular old IDIS, go ahead and create that 2020 ESG-CV project. Then you're going to link that 2020 project to your 2019 substantial amendment within that action plan, econ plan module. So for ESG-CV, that single 2020 project is going to include both your regular Formula 2020 allocation of funding and your ESG-CV funds. And this is just a limitation of IDIS that we needed to create it this way. If you have any questions, if you're using that 2019 plan on how to do this linked project, please reach out to your field office and we'd be happy to help walk you through it. And also that guide really shows you step-by-step how to do it. And next slide. All right. Finally, let's walk through the HOPWA-CV project setup. So similar to ESG-CV, adding HOPWA-CV projects when you're doing a 2019 substantial amendment is going to require you to create that 2020 project first and then link that 2020 project to your 2019 plan. Your AP 35 screen should identify the new separate CV 2020 projects. There will be one for the grantee and then one for each known project sponsor. If you've not yet identified your sponsors, you can still apply, still submit your amendment. You can do so creating a placeholder, but you'll need to update it timely after you've identified who those sponsors are. You're also going to want to provide a budget description of the funding and the proposed household count by eligible activity in the project description boxes. And finally, we recommend you enter the project title using the standard HOPWA naming convention, but add CV-COVID-19 to that project name, again, just to make it really clear for everyone's tracking and reporting purposes that this is your HOPWA-CV project.
To add to that, Katie, I think a couple things. One, we just want you to think ahead to what your reports would look like when you go into IDIS to look at where your projects are. That naming protocol throughout is going to be real critical for projects and activities. In that, think about a PRO2 report that you might pull to see where projects are that you might be sharing with staff. If you can quickly visually see what CV projects are and sort by that in BOSMAC, it would be a real helpful way. So naming protocol, we've stressed a lot. It's for a reason. We think that'll help in the long run for reporting and tracking. Just another point of clarification, I know we did not send these slides out in advance. Our apologies for that. But two notes. One, all of these instructions are posted on the HUD Exchange. I know the link has been posted in the chat a few times by our team, so you can get the instructions from the HUD Exchange. It should have been mailed to you by your field office reps. If you haven't gotten that yet, please reach out to your field office and they will send you these step-by-step instructions. And we will post these slides on the HUD Exchange as well. Just give us a couple of days for that, but they will get posted.
Thanks, Jill. So on to the next slide.
Next slide, last slide. So thank you, Katie. Great job. You covered a lot of territory. We want to field a few questions about this IDIS process in particular and start right with the beginning. So picking a program year to amend, that has been one of the questions that has come up. So to our panel standing by, Katie and all, there are some folks that are still have some questions about these straddle years. So they have submitted a 2020 plan in the last few days, so it has not yet been final review or approved, but they have a amendment prepared to go. Should they attach their amendment to 19 at this stage, or just wait for their field office to approve 20? Do we have some feedback on that one?
This is where I would say communication is key. So please reach out to your field rep and find out the status of where they're at in the review. They may indicate that, hey, I'm almost finished, and we anticipate approving your plan shortly, or they may indicate that it's going to take them a longer time for one reason or another, which may mean that you would want to discuss 2019 substantial amendment. But I'll hand it over to some of my other panelists to address that as well.
Hey, this is Jesse. Can everybody hear me?
Hi, Jesse. Thank you for joining us. We can hear you.
So strategically, if you're a grantee, and most CDBG grantees have program years where they're submitting this week. So more than half of the 1,250. So if you're submitting this week and you're just putting in your 2020, you can go ahead and do your 2019, because technically until HUD has completed its 45-day review period, the 2020 isn't there to get amended yet. Where the trouble gets in with the 2020 is if HUD has completed its review, and it frequently does complete it earlier than the 45 days, and is moving ahead to get you the grant agreement, we have streamlined out the one of the delays that used to happen between when we completed our reviews. We got rid of an internal step, so we're moving faster than you're going to be used to. So it is critical to talk to your field office if you submitted your 20 a while ago, because it's probably about to come out, and then you would be amending your 20. I mean, that's essentially, and so the field you need to talk to them.
Thanks, Jesse. That's great. So another question related to that, is there any, and this is for maybe our IDIS folks, Ben and Robert, are there any limitations on the number of amendments that could be made? So if I'm in 2019 and I want to amend my standard CDBG program for new uses, as well as the amendment for CV, can I have multiple amendments, or is there a cap on that?
You cannot, excuse me. Okay. You cannot amend more than once per program year. So there's only one effective plan per year, and you can open one amendment to that plan. In IDIS several months ago, it's kind of a new functionality designed to help keep track of amendments. A lot of grantees have been using the plan name kind of creatively to keep track of which version is which. Now that is different. The way it works is there is only one plan per year, and you can go in and create one amendment for that one plan per year, and to better keep track of all the different versions.
And to piggyback off what Robert just said, with the new amendment functionality, you are only able to amend the plan at one time. So you can't have two open amendments for the same program year open at the same time anymore. So if you are doing multiple amendments, say if one program office is not ready, then you can submit your amendment. It would have to be then either returned back or marked as review completed by HUD in order for the grantee to reopen that same plan again to continue with another amendment.
But this isn't answering the question yet, because the question actually turns on, I have to do amendment to my regular program and I have to do CV. So in that case, I'll ask the IDIS experts because I can. Would we tell them to go ahead and do one set of amendments in their 2019 and the other set in their 2020, or do they definitely need to talk to their field office, right?
So that was another question that I saw come into the chat very closely related to this. There was a question about, well, my 2019 program year is over. Would I still amend 19? Or another question was related to having already received an approval to the 2020, but they're using 19 funds. So if you're using the older funds, do you go back and do you amend the older plan? So we do want to make this as simple for everyone as possible, and when you can just do one amendment to include everything. And as additional rounds of funding come out, as was discussed, you can add on those 424s using a process that was mentioned in the presentation. If you have prior year funding, there is a line on if you do your 2020 plan and you want to use some 19 funding for coronavirus response, in the anticipated resources section of your plan, you can use prior year resources. So you can reprogram some of the 19 funding on your 2020 plan.
But what if you're reprogramming 18 and it's not for coronavirus? It's just regular reprogramming, or 19 funding and it's not for coronavirus. But should
Again,
you put
those would be marked as prior year resources on your current plan.
But what if it's not for coronavirus? That's the question that's in the chat. What if they have amendments both for coronavirus?
It's the same function. It's the same functionality either way.
But do we want it in the same amendment?
So if you need to do amendments for your regular program, then you would need to include them with your coronavirus-related amendments, because you can only have one open amendment per program year.
And I think that part's the critical answer, so one per program year. So if folks have 2018 amendments they're working on, non-CV related, they could submit a 2018 amendment and also be working on a 2019 amendment that is COVID specific. So you might be, lots of communities do these year-end amendments to clean up loose ends and projects that are changed. You can still do that, but not two in the same program year. Is that what you're saying, Robert?
Correct. You wouldn't do two amendments in the same program year. Correct.
Thank you. We have another question related to amendment process and how it relates to a consolidated plan. So we have talked about amending an annual action plan and not specifically any issues related to the 5-year consolidated plan. So for the people making amendments to 2019's annual action plan, is HUD requiring a companion con plan amendment?
Hey, this is Jessie, and this one's for me. When we published the flexibilities guides for CDBG-CV and for ESG-CV, they both came out with cover memorandums that had a really big waiver in them. And the waiver, if you read it, is going to, if you don't want to go look up the law, what it essentially did is it carved the CDBG-CV grants and funds used for CV in the covered program years for the respective programs away from having to comply with the consolidated plan. So the answer is you don't have to amend your consolidated plan in conjunction with your CDBG-CV or ESG-CV grant. However, if you ask me as a grant administrator and regional planner whether it would be a good idea to catch up with your con plan later, I would say yes. Now, the instructions also walk you through on the IDIS side what you have to do in the system. Robert, is there anything in the system they have to do for the con plan part of it?
Well, again, because of the waiver, no, you don't. And I think a lot of people realize that if you don't go back to your strategic plan and modify your goals, then the system maybe won't generate the CAPER in the way that you would like, and you might have a little bit of extra work to do to align your projects and your goals and your accomplishments when you do your CAPER. But you do not have to go back and modify those goals in order to submit for CDBG-CV. That has been waived.
We've had a lot of questions around that, Jesse and Robert, around do we need to add goals? If we didn't have healthcare-related goals or economic development and we're responding to the economic impact of COVID, the function of creating goals as it plays out to the CAPER. So do you want to expand on that, thinking ahead of how this, change in use of funds ties back to goals leading to a CAPER?
It's waived. It's waived. It's a statutory waiver implementing the statutory waiver authority that we have under the CARES Act, and in CDBG's case, we could have implemented with some of our disaster suspension authority. It's just waived. But as Robert said, it's going to make for maybe a messier CAPER if you don't do a little cleanup. But you will be reporting for CDBG-CV, you'll report your national objectives. So you'll have output requirements, right? You'll be counting the number of people served or whatever it is for that for the activities you fund. But you're not going to have these big overarching goals as a requirement. Now, the consolidated plan part, you are cut loose from having to follow the consolidated plan is essentially what's going on. So just for CV, only for CV. So we can talk you through, how you might do it in IDIS, but the instructions that we posted are for the required changes. And if it's not in those instructions, it's not required. If people want to know how to do it, if they want to do it, we can oblige that, but it's going to be a little later.
Great, thank you. We have some questions specifically related to the setting up projects in the 35 screen. And I would like to invite our friends from SNAP, Ben or Marlisa, to talk about just the nuanced difference. Again, Katie did this, but we have some questions again about it. Setting up an ESG project, an ESG-CV project, and how that differs from CDBG-CV at the project adding stage. Just don't forget to unmute your phone, Ben.
Yep, nope, sure. So for ESG, since your ESG grantees can only have one project per grant year in the system, if you are amending your 2019 annual action plan and you go through the normal process of trying to create the project on the AP35 project screen by clicking the create a new project link, the system is going to create a project for that 2019 program year. So if you already have the 2019 ESG project created on that project screen, you're not going to be able to create that project for 2019, nor should you have a 2019 project since it's a 2020 grant. So in order to create a 2020 project for ESG, you would need to go into the IDIS projects module. Earlier we went through the steps. You would click add a project and you are then able to select the 2020 program year. Now if you are a grantee that has already been working on your 2020 to 2024 con plan or a 2020 annual action plan, you may already have a 2020 ESG project created. So if you try to go through those steps and you get an error message saying you cannot have more than one ESG project per grant year, then you may want to look in IDIS and see if there's already an existing 2020 project for ESG. At that point, you can then add that 2020 project to the AP35 projects table in the 2019 action plan.
Great, thank you. I think that helps muddy the muddy waters, right? We know there's going to be questions about that as you all go forward setting up these amendments, and just encourage you, go back to those instructions and continue to speak with your field office reps. We will be sure to follow up. There is also the option, as a reminder to everyone, to send questions into the Ask a Question on HUD Exchange, and we are, as you can imagine, getting a lot of those questions right now, but trying to field them as quickly as possible. First course of action is if you can, need a quick answer, to call your field office, but the Ask a Question also is responding to a lot of these and posting them as quickly as possible. So we had some questions related to citizen participation still. This one seems to be a perennial question that is coming up about what the waiver permits and what should be done given the year selected for an amendment. So right now, the waiver allows for 5-day periods and the opportunity for virtual public meetings if needed. Would someone like to clarify that for our grantees in terms of what they must complete at minimum and how to add that documentation into the amendment 8025 screen?
Hey, this is Kimberly Dana from the Office of Block Grant Assistance. So there's a couple of issues to consider with regard to the virtual hearing. First, substantial amendments in our regulations do not require a hearing. So if you have a hearing in your citizen participation plan, you can either elect to not do a hearing, or you can go ahead and do the hearing, but you would do a notification as an amendment to your citizen participation plan that you will be going virtual with the amendment. The amendment, the virtual hearing piece is very broad. We don't have a very prescriptive way in order to do it. Some folks are doing Zoom and some folks are doing WebEx. The most important piece is demonstrating that citizens had access to the meeting and were able to participate, and that you've made it given a maximum amount of access, and made it, someplace easy for them to access. In terms of documentation, you would simply upload the notification that indicates how the public hearing was made available to citizens, and a summary of the comments that occurred in the hearing and how they were addressed. If that is not correct, if there's anything that I said there that's not correct, please jump in, team.
Yeah, Kim, you're fine. I just want to add that we have a lot of grantees who add extra hearings on, and your answer about not having to do a hearing only applies to when you added more hearings in your citizen participation plan than the ones that are just required in the regulations for CDBG. We didn't waive the requirement for the required hearings, but we did waive your ability to, you don't have to follow your citizen participation plan as it exists. You're allowed to amend it concurrently with your action plan amendment or your amendment, your action plan. So just want to be real clear on that. There still are some required hearings, and no matter what kind of hearing you do, whether it's one of our required ones or one of the ones you've added on, if you do a hearing, then you can do virtual.
Thank you, Kim and Jesse. We have a series of questions that relate to the application in terms of the SF-424 forms and the CDFA numbers and grant numbers. So I think we put some information in the chat, but just to underscore that, the CDFA number is the same for CV grants as it is for standard formula grants, correct?
That is correct.
Correct at this time, yes. I think we're going to try to hold on that.
Yeah, that's correct.
Okay. So the 424 forms have been loaded on online. The instructions that were sent out include a link to the 424s and the certifications for folks that are asking about where to access those. There are links included in the instructions so that you can include those with your amendment on the AD25 screen. And grant agreement numbers is another question we've got, or grant number, contract numbers, and those have been issued. So the field office has those available now to generate grant agreements and can provide you that for your 424. Am I correct about that, Katie?
Yes, you are. Your field offices do have the grant numbers available, and they will be new grant numbers for each of the CV grants.
Right, and they are all 20 numbers, I believe, B20 or whatever 20, wherever the year is, but you can still put them on your 2019 amendment because of the waiver.
Thank you. So we have some questions related to setting up projects versus activities in IDIS as well. So at this stage of the amendment, the most information that HUD would need would be just project level information, not necessarily down to activities. Is that accurate?
Hi, this is Marlisa.
I'd like to answer on the reg for CDBG, because this is a really critically important CDBG question on the policy, on the reg side. And then all three programs are approaching it a little differently. For CDBG, what you have to give to your citizens is the same required information you always have to give to them. What you have to enter into the amendment when you enter it in to IDIS is the same level of information that you always have to enter. we didn't waive any of the regs about the content. And the sort of basic rule is that citizens are supposed to know how they're going to be affected or how they can participate. And that's for the entitlement side. So I just want to, you know, if the question is thinking that we said you could just put a 3-word label on it, that's not where we're going. Okay, sorry, I interrupted somebody.
Oh, no problem. If I could just add on to that, I think some of the questions did reference in the amendment instructions, there's a footnote about state CDBG-CV. In the footnote, it mentions activity level data not required, and it mentions the screen that's required for state CDBG grantee regarding the method of distribution. So for those folks, it'll be a little bit different than your traditional entitlements. They won't have as specific projects listed for the types of things they're going to fund. They may only provide us with a method by which they will distribute the funding. And it's possible that the uses, the ultimate uses would be less clear, and it will depend on their application process that they set up using that method of distribution.
And Marlisa, would you like to take that from the ESG perspective, or Brett?
Yes, for ESG-CV, you'll see in our substantial amendment instructions that you should be providing a high-level summary of all eligible activities. Because there's only one project allowed that encompasses the entire grant, you should cover all components that you're going to be funding. So, you know, there are only 5 possible activities plus admin that you could be funding under your grant. So you know, if you're going to be, if you intend to fund rapid rehousing, prevention, street outreach, and shelter, and HMIS, you should state that in your project description. We also encourage you to be as flexible as you can in your the language in your description, so that you can provide flexibility with, you know, shifting funds as necessary. So you know, we wouldn't recommend that you tie a specific dollar amount per component or budget line item. So you have the freedom to build in some cushion in that description.
Thanks. And Katie Pittenger from HOPWA, do you want to tackle that one also from the HOPWA perspective, so we hear from each program?
Yes. So for HOPWA, projects are definitely required in the amendment. In the description box, though, we are looking for information on the activities, the budget line items, so the households that the expected households to be served and the dollar amounts there. The activities are not required for the amendment, but they must be created in order to draw the funds later. So that is an expectation kind of down the line, but for the amendment, it's just at the project level that we'll need that information.
Great, thank you. A couple other, I think we got all the programs there, but just don't want to jump out until if there's anybody else on that project issue. Otherwise, I wanted to move to some expenditure date questions. We've been getting those questions as well. From reading the initial CARES Act to today, can each program area, and I'll start with CDBG, speak to the sunset date on the funds, when funds need to be expended? So if, Jesse, you would start, and then we'll go to ESG and HOPWA for that too.
Sure. The CARES Act gives HUD until September 30, 2022 to obligate all funds to grantees. We are going to beat that by a lot with help from grantees. That's exactly the same kind of deadline they give us for regular CDBG, by the way. We just have a set period of time to get everything into grant agreements. After that period of time, after a grantee gets its grant agreement, there will be a period of performance That is going to be set by the notice, and it's set in accordance with 2 CFR 200. I believe it's also being set into the grant conditions that you'll get when you see your grant agreement. There will be a period of performance. It's going to be based on our experience with the durations of the activities we normally see. I think the funds are actually available for expenditure for a total of 8 years from the day of enactment, March 27th. But the period of performance will be somewhat shorter because we're all urgent and we want to, you know, move to address the pandemic. But I can't tell you the exact period of performance yet because the notice is not through clearance.
Thank you. I think that gets us warmer. And ESG, Marlisa or Brett, if you would speak to the sunset date of funds for CARES Act?
For ESG, we just need to wait for the notice to be able to let everyone know what the specific expenditure deadline and the expenditure and obligation requirements are.
Thank you. And Katie, you get to hit the home run here because HOPWA has their notice out. So do you want to address that?
Yep. So for HOPWA, the period of performance is 3 years, just like other HOPWA formula and competitive grants. The start of the period of performance is the date of the signing of the grant agreement. So the last signature on the grant agreement that executes the document kind of starts that 3-year ticker. Yep.
Excellent. We also have a question to clarify the amendment process. This is, I know, confusing for folks, and we said that you can only do 1 amendment per year for each program. But what I want to put a clarification on for folks is for those grantees that are in a consortium, you are submitting multiple amendments for each member of the consortium. So what HUD will do is normally where we say, you know, approved at the end of the process, or in middle of the process we say, reviewed, awaiting, submitted and awaiting modifications. That awaiting modification stage is where we're going to live for a while for all the various members of the consortium amendments coming in. And that will allow for additional members to submit their amendments. Katie, do you want to expand on that question? We've gotten several questions incoming about just if it's only 1 per, how do we handle consortiums? And don't forget to unmute.
Assuming you mean Katie Burke, I'll jump in on that. I know we've got a couple of Katies.
We have a couple of Katies today.
Yeah, so for consortia, you will just have 1 amendment that will be open. You'll all need to agree. The lead member of the consortium will need to create that 2019 substantial amendment, if that's what you agree to, or if you already have your 2020 plan approved, you can amend your 2020 plan substantially, and you will all use that same CARES Act version, and you'll be able to, through our expedited review process, as communities are ready, say only 2 consortium members are ready to submit, you know, tomorrow, they could upload their SF424 documentation, add their projects, update their AP15s, let the lead member know. The lead would hit submit. The field office would be able to turn it around as quickly as they can, hopefully be able to make grant agreement awards and put that plan right back into reviewed and awaiting modification status. Then the other members can start adding in their pieces and let the lead know when they're ready to submit. So the lead agency is going to have some additional responsibility and really need to make sure that they're communicating about who's ready. But unlike with your initial big formula plan submission where absolutely everyone needs to be ready and the plan can't be considered complete until all members have had their plans approved, instead we're able to individually approve individual grants for each of the consortium members as they're ready to be approved. So this should be an easier way for consortia to more quickly get access to their funding and not have to rely on everyone to be ready at the same time. Did that fully get to it, Jill? Did I miss anything?
Yes. Yes, thank you. I think there was just a a slight confusion about one amendment versus what happens in a consortium where there will be multiple partners, multiple members of the consortium coming in. So each individual community would have their own amendment, and that will be permitted. You guys have a lot of questions about citizen participation, and want to ask Robert, if I could you loop back to the 5-day comment period and how that applies to 2019 money versus 2020 money?
Absolutely.
So, thank you.
Yeah. So the provision for 5 days, as well as the virtual hearings, doesn't only apply to the CDBG-CV funds. In addition, those provisions can be taken advantage of if you're reprogramming other 19 or 20 funds for the purpose of preparing for or responding to coronavirus. So you don't need to do, you don't necessarily need to do a longer public comment period or in-person hearings if what you're working on is for coronavirus. So.
Great, thank you. We have a couple, I know we don't have a lot of time left. We do have a number of programmatic questions that have come in. Just to touch on a few of the more common themes that we've had, if I could call on Jesse or the OBGA team to talk a bit about, we have a number of communities who have asked about urgent need and how to use urgent need, especially in those communities that haven't had any disaster experience, and COVID being a disaster, to serve some community needs that might not traditionally be low mod. And, you know, with the caveat, of course, that the 70% low mod overall benefit must be observed, including in the CARES Act funding. But could you talk a bit about urgent need and what that might look like, or if there is some guidance coming in the notice?
This is Jesse. I can do that. It doesn't really matter about disaster. Urgent need is available in the regular CDBG regulations at all times. It deals with an urgent need affecting community health and welfare that has arisen, usually we say in the last 18 months or so, and that for which the grantee will certify that they have no funding available. So I think it's fairly clear that a pandemic would responding to a pandemic would meet the requirements for urgent need without a whole lot of documentation, particularly while you're under the public health emergency order. The notice, we've got a lot of requests from grantees and a lot of this question quite a few times, and have asked for some additional description of what documentation would be appropriate if you were, you know, doing urgent needs to address a pandemic, and we definitely want to address that request, and we're looking at it. I'm a little hampered because we're in a phase in the notice where I'm not supposed to talk about specifically what's in it.
Fair enough, just that more information will be coming in the notice, but that urgent need remains a national objective, and so long as it meets the traditional requirements, can be an option.
Yes, absolutely, and the 70% overall benefit is in place, as you noted.
Excellent. We've also had a number of questions around the emergency rental assistance question, and I know that you fielded this one, Jesse, from field staff, but the idea of using CDBG-CV to assist with rental assistance as a public service. Would you want to speak to that and perhaps, you know, focus on some of the alternative sources that we have discussed in-house?
Yeah, I can do that. And then you probably also want to hear from the ESG folks, though.
Yes, exactly.
So we get a lot of questions about rental assistance, and obviously rental assistance is not the name of a CDBG eligible activity. It's not on the list in the law, and if you look at 570.207 of the CDBG regulations, you can see that income payments, the repeating payments for rent or mortgage or any kind of subsistence is ineligible under CDBG. But at the end of that paragraph, which describes them as being ineligible, it says that emergency payments for rent, utilities, mortgage, and that sort of things made to a provider, so not to the household or family, over a period of no more than 3 months are eligible as a public service activity. And so that's in play, that's in the reg, it's in the entitlement rule. Now, not every state supported HUD's reading that into the entitlement regulation back in the 90s when it was put in the regulations. So not every state allows it because in state CDBG, states read directly off the law for eligibility and they get to make up their own minds what the law means. Entitlement is their boundary, sort of for the outer markers in a way. But so it is possible, and we get a lot of questions. Now, in this space, as I warned our field staff, there are a lot of other potential funding sources for rental assistance, depending on the household or the program design. ESG is there. I think HOPWA might be there. And we're also seeing grantees, or states and local governments that got the Treasury money for local governments. Some of them, and Montana is one that I've seen, are launching rental assistance programs as well. And obviously there's some movement in the public housing space. So this is an area where the requirement that grantees have policies and procedures to prevent duplications of benefit. This is one of those spaces where duplications can happen. So you need to be careful in your program design. And I would say ESG probably needs to step up too. I'm pretty sure we're in that space.
Marlisa or Brett, do you want to chime in on that one as well? And then Katie from HOPWA.
I would just say from the ESG-CV standpoint, be very intentional about, you know, as Jesse said, your program design. Typically, you know, ESG is used to provide rental assistance under the rapid rehousing and homelessness prevention component. So, you know, it's something that ESG recipients and providers are familiar with. So, you know, just be intentional, be deliberate when you're thinking through which formula program you're going to use to fund which type of activity, and then, you know, just be careful that you're not duplicating the benefit. You're not using ESG in addition to CDBG for the same activity. I mean, I think the safe harbor would be to use your ESG funds for rental assistance, and just think about like a strategic allocation of those resources. What makes the most sense, and which program makes the most sense to cover those costs and address that need.
Thank you. Katie, do you want to speak to HOPWA? We have a few moments left.
Hi, this is Rita. Hi, can you hear me? This is Rita Harcrow for HOPWA.
Oh, hi, Rita. Yes, we can. Thank you.
Hi. I'm going to try to answer this one. So what we're asking is for, as everyone said, for grantees to be aware of the other resources available in their communities and to develop a local structure that makes sense based on what those other resources are. And for HOPWA in particular, we're aware that the Ryan White providers have received CARES Act funds as well that can cover many of the same activities that HOPWA will cover. So we're working with the Ryan White program already to develop a crosswalk on that. Again, just being aware of what those are and that we are working on additional guidance for that.
Great. Thank you, Rita. Natalie, I think we're nearing the end of the time, if you would check me on that. So I want to thank all of you for joining us today. We've covered a lot of material. I know there are still a number of questions coming in. So just as a reminder, these slides will be posted on the HUD Exchange, and even more importantly, the detailed instructions are on the HUD Exchange. You can ask your field office reps to send those right to you. And either way, they are detailed, and it shows lots of screenshots of IDIS, each step that you would need. So please reference those, have them handy. We know you're working under unusual circumstances and maybe can't hang them up in your bulletin board in your offices right now, but they are posted, and we hope you'll make good use of them. If you continue to have questions, we said this many times, please call your field office reps, let them know what your questions are. We are floating questions back and forth as you come up with them to better inform our responses and how the programs are rolling out. On the duplication of effort, I know there are a number of duplication of expenses. There are a number of efforts underway to provide continued guidance from our TA providers and HUD team that will continue to be posted on the HUD Exchange. There is some good information in the disaster recovery pages on that Jesse has referenced in previous trainings, so we'd encourage you to look there. So with that, we really appreciate your time. I want to thank you on behalf of HUD for joining us today and continuing to do this hard work, and thank all of the panelists who joined us to share their expertise and information, and wish you well. Thank you.